Adolescence. That turbulent, transformative bridge between childhood and adulthood should be a time of growth, discovery, and possibility. But today, for millions of young people across the world, it's becoming something far more alarming, a health emergency. We're witnessing an unprecedented rise in both physical and mental health challenges among adolescents. This isn't a crisis unfolding quietly in a few corners. It's global, it's intensifying, and it's being fueled by modern life itself. According to the World Obesity Federation, more than 480 million young people between the ages of 5 and 19 could be overweight or obese by the end of this decade. That's nearly 500 million children and adolescents, a staggering figure that's more than just a warning. It's a wake-up call, because obesity is rarely just about weight. It's about the early onset of chronic diseases, compromised mental health, and a burden that follows young people well into adulthood. To understand the urgency of this crisis, we must understand adolescence itself. Spanning roughly ages 10 to 19, this phase is marked by hormonal shifts, emotional turbulence, identity exploration, and rapid physical development. But it's also the first time young people begin to make independent lifestyle choices influenced by their peers, their culture, and increasingly, the digital world. Adolescence is a window of opportunity to establish lifelong habits, but if left unsupported, it's just as easily a window through which serious health problems can enter and stay. Around the world, adolescent health has now taken center stage, not just among healthcare professionals, but among educators, parents, and policymakers. Yet despite increased attention, the numbers are moving in the wrong direction. Obesity rates are climbing. So are anxiety, depression, and suicide. Substance abuse, risky sexual behavior, and poor access to healthcare further complicate the picture. And as more teens adopt sedentary habits and poor diets, we're seeing the rise of chronic illnesses that were once reserved for adulthood. This is not a cluster of isolated issues. It's a systemic crisis that's pushing a generation to the edge. Of all the warning signs, obesity stands out not only because it's visible, but because it's growing so rapidly. We've never seen adolescents living with such levels of excess weight, and it's not just a Western issue. It's happening in cities, suburbs, and villages across every continent. So, what's fueling this epidemic? Fast food, processed snacks, and sugary drinks are aggressively marketed to young people. At the same time, screen time dominates free hours, whether for school, socializing, or entertainment. Physical activity is no longer part of daily routine for many teens, especially in urban areas where parks are rare and streets feel unsafe. And while in some countries, poverty drives obesity due to limited access to fresh food, in others, affluence leads to excess. In both cases, young people are eating more, but getting less of what they truly need. These aren't just aesthetic or short-term concerns. Adolescents are now facing diseases like type 2 diabetes, cardiovascular problems, joint issues, and sleep disorders. Conditions once thought of as adult-only are being diagnosed in children. And the emotional toll from stigma, bullying, and low self-esteem is just as damaging. Mental health is another pillar of this crisis, one that often remains invisible until it's too late. Across the globe, mental illness is now one of the leading causes of disability among adolescents. From depression to eating disorders, self-harm to panic attacks, young people are struggling silently, and in many places without support. So what's driving this surge in mental health issues? Academic pressure is a major factor, with exam stress and future uncertainty weighing heavily on teens. Then there's the digital world, where social media platforms have become arenas of constant comparison and validation seeking. Family instability, trauma, and body image issues add to the emotional load. And of course, the COVID-19 pandemic introduced prolonged isolation and anxiety that many young people are still processing. The result? a generation overwhelmed and too often unheard. Physical and mental health don't exist in isolation. They influence and reinforce each other. A teenager struggling with obesity may also be dealing with bullying, shame, or depression. Likewise, someone experiencing mental illness may sleep poorly, eat irregularly, or withdraw from physical activity, further damaging their health. To treat one without addressing the other is to miss half the story. We cannot talk about adolescent health without confronting the environments they're growing up in. Unhealthy foods are not just available, they're everywhere. Apps, ads, and algorithms promote content that distracts and distorts. Cities are designed for cars, not children. And digital devices are now both friend and foe, offering connection but also fueling disconnection. Crucially, inequality makes everything worse. Marginalized youth face higher risk exposure, with fewer support systems in place. The result is a cycle where the most vulnerable suffer the most. Though the adolescent health crisis is global, it doesn't look the same everywhere. In sub-Saharan Africa, urban obesity is rising while undernutrition remains a rural threat. In South Asia, anemia and early pregnancy are top concerns. The Middle East is seeing dramatic increases in inactivity and weight gain, while Latin America grapples with rising suicide rates. In high-income countries, the conversation often centers around eating disorders, digital addiction, and self-image. Each region has its own challenges and its own urgent need for action. This crisis isn't inevitable. It's man-made and reversible. We need immediate multi-sectoral change. Healthcare systems must be better equipped to handle adolescent needs, from training providers to integrating mental health into routine care, to making clinics feel safe, supportive, and youth-centered. We must hold the food industry accountable by taxing sugary drinks, limiting junk food advertising to children, and making healthy options accessible, especially in schools and low-income communities. Physical activity must be woven into daily life through mandatory physical education in school, walkable neighborhoods, and community-based sports and fitness initiatives that welcome everyone. Schools are critical. They should teach mental health and nutrition, provide access to counselors, and routinely screen students for early signs of health challenges. Education isn't just academic, it's personal. Schools, parents, and communities can all play a role in shaping healthier behaviors and attitudes. Peer-led initiatives, parent engagement, and culturally sensitive outreach are all essential for creating real, lasting change. Social media can distort body image, reduce sleep, and increase anxiety. Screen time often replaces real-world interaction and physical activity. But when used responsibly, tech can connect young people with support, from mental health apps to online counseling, fitness challenges, and educational content. The key is balance and guidance. This crisis was built by systems, but it can be changed by leadership, empathy, and action. We must invest in policies that put adolescents first. Listen to their voices, empower them with knowledge, and include them in the decisions that shape their futures. As we reach the conclusion, it is observed that the adolescent health crisis is not an isolated issue. It's a reflection of our priorities. We cannot afford to lose this generation to obesity, depression, preventable illness, or silence. But if we act now, boldly and compassionately, we can turn the tide. Because when we protect the health of our youth, we safeguard the well-being of our world.
Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more valuable insights on appraisals, revalidation, and interesting topics in healthcare.